The urinary bladder and prostate diseases in dogs and cats. The urinary bladder diseases are lower urinary tract disease, LUTD, bacterial cystitis, feline lower urinary tract disease, or FLUTD, and urethral obstruction, and lower urinary tract tumors. The prostate diseases are benign prostate hyperplasia, prostatitis, and prostate tumors. Also discuss urinary bladder rupture. The lower urinary tract disease, the signs are dysuria, stranguria, hematuria, polychuria, incontinence, and dehydration. For the key evaluation, you need to exclude urethral obstruction or bladder paralysis. In bacterial cystitis, it's more common in dogs and cats, and it's more common in females than males. The pathogens are E. coli, Staphylococcus, Streptococcus. For treatment, for simple infections, give antibiotics for 7 to 10 days, and in complicated cases, give antibiotics for 3 to 6 weeks, such as amoxicillin clavulanic acid, cephalosporins, and fluoroquinolones. For feline lower urinary tract disease, the causes are idiopathic cystitis in around 60 to 70%, urolithiasis in around 20%, and bacterial cystitis for 1 to 3%. The treatment is to increase water intake, NSAIDs, opioids, and gabapentin, and to have stress reduction and environmental enrichment, and prescribe urinary diets. For urethral obstruction, it happens in cats. It's dangerous because it can lead to a bladder rupture and cause post-renal azotemia. It is treated with emergency catheterization, and if that doesn't work, you can do a decompressive cystocentesis. In lower urinary tract tumors, the most common tumor is a transitional cell carcinoma, and the location is at the bladder trigonum. And for treatment, you do surgery and you can give NSAIDs, such as piroxicam. For prostate diseases, the signs are urethral bleeding, tenesmus, hematuria, and UTI signs. To diagnose it, you need to do a rectal palpation to see the shape, size, symmetry, and pain, and then you can do imaging such as X-ray and ultrasound, as well as urine analysis, cytology, and biopsy. In the case of benign prostate hyperplasia, the cause is hormonal influence, and for treatment you have castration and anti-androgens. For prostatitis, the predisposition is benign prostate hyperplasia, and the treatment is antibiotics and drainage or castration. For prostate tumors, the most common is adenocarcinoma, and the treatment is surgery, NSAIDs, such as piroxicam, and palliative care. And urinary bladder rupture, it can be caused by trauma, cystitis, tumors, or urolithiasis. It's diagnosed through imaging, and the abdominal fluid can have a serum creatinine ratio of more than 2 to 1.